All right, we'll go ahead and get started. Welcome everyone to today's workshop. In partnership with Health Services Advisory Group, the California Department of Public Health Healthcare Associated Infections Program presents today's workshop, Infection Prevention and Control Training for Certified Nursing Assistants, a train-the-trainer workshop for facility educators. I'm Erin Garcia. I'm the HAI AR Prevention Project Supervisor at the HAI program, and I'll be your host for today's webinar. Just a few housekeeping reminders here on the screen. This session is being recorded. We will post a recording as well as the slides from today's presentation on our Train the Trainer workshop resource page. That's the same page where you registered, so make sure you bookmark that. If your name does not show up, go ahead and right-click to rename yourself. This is how we keep track of attendance. We ask that you do please stay muted if you're not speaking, but we want to encourage engagement, ask questions, leave comments in the chat, or you can unmute during the discussion later on today. And we'll monitor the chat throughout and address any questions during the discussion. And then lastly, CEU are available for this workshop. Please stay for the entire presentation to be eligible for CEU. We'll go over how to claim CEU at the end of today's workshop. And this is a slide we present in all of our courses to make ourselves aware of implicit bias. Implicit bias describes how our unconscious attitudes or our judgments can influence our thoughts, our decisions, or our actions. This includes any involuntary or unintentional perceptions made without us even being aware, and occurs as our brains sort out information and perceive data to understand our world. Our implicit biases can affect our decisions, which can contribute to societal disparities. So in being self-aware about our own implicit bias, we can promote better healthcare diversity and equality. You can learn more about your own implicit bias at Project Implicit at the website listed here. So this is the third topic of 4 in our Train the Trainer workshop series. These workshops, again, they're for skilled nursing facility staff who are responsible for training frontline healthcare personnel. So this might include facility or corporate IPs, DONs, or DSDs. And in order to provide effective training on CNA IPC practices, trainers really need to understand what those IPC concepts are as they relate to CNA tasks and responsibilities. They need to be able to assess and reassess their CNA IPC training needs, be familiar with the available training materials and tools, which we'll go over today, and also provide regular IPC training to CNA. So today's workshop will walk you through our new infection prevention course curriculum toolkit and implementation guide for skilled nursing facilities, as well as local health departments, to provide IPC training for your CNAs. The toolkit will be made available along with the slides and the recording from today at the end of this week's workshop, so look forward for that announcement in the coming days. We'll share the toolkit on both the Train the Trainer resource page, as well as the HAI program Project Firstline webpage. So by the end of today's workshop, you'll have a better understanding of how to navigate that toolkit. You'll have the tools you need to implement IPC training to your CNA staff using Project Firstline curriculum. You'll know methods of how to assess and reassess your own staff's training needs, and you'll be more familiar with the process for sustaining IPC knowledge among your facility CNAs. So it's now my pleasure to introduce you to our instructors today. This is our Project Firstline team. Sophie Frank is our Project Firstline health educator. Aurora Avalos is one of our Project Firstline nurse educators. And Shannon Malinzak is also one of our nurse educators. So Sophie, Aurora, and Shannon, I'll turn it over to all of you.
Thanks so much, Erin. So let's begin with 2 poll questions. As the facility educator, how do you ensure that your CNA staff adhere to IPC practices? Select all that apply. A, provide education and training. B, conduct adherence monitoring, for example, hand hygiene. C, provide feedback to healthcare personnel. D, engage CNA to be part of the solution. E, all the above, or F, other. And please specify or share in this chat. I'm going to give a few moments just to make sure everyone is able to participate. Looks like I already see people adding in their answers. That's wonderful. A few more moments. You have about 60% of the group participating. A few more moments. All right, I think we can go ahead and end that chat and share the results. Perfect. It looks like 16% provide education and training, 16% conduct adherence monitoring, 11% provide feedback to healthcare personnel, 6% engage CNA to be part of the solution, and 88% are all the above. That's wonderful. These are all great responses and great to see the different ways in which you're ensuring that your staff adhere to IPC practices. Let's move on to poll number 2. So what are your barriers to implementing training for IPC in your facility? Select all that apply. A, not sure where to start. B, lack of leadership support for CNA IPC training. C, not sure what training materials to use. D, time constraints or staff availability. E, not feeling confident with level of CNA IPC knowledge. Or F, or other. And if you can, share what other barriers are in the chat. And once again, I'm just going to give a few seconds to make sure to give time for everyone to participate. And I'm not seeing the poll on my end, but feel free to add in your responses. We'll give a few more minutes. All right. We'll end that poll, and thank you so much, everyone, for participating. We'll come back to these barriers. It looks like, oh, there we go. There's the poll. So 13% said not sure where to start. 27% said lack of leadership support for CNA IPC training. 32% said not sure what training materials to use. And 66% said time constraints or staff availability. 21% said not feeling confident with level of CNA IPC knowledge. And 8% said other and shared in the chat. So once again, these are barriers that you might be facing, and we're going to come back to those barriers towards the end of today's workshop. I'm now going to pass it over to Sophie to introduce Project Firstline and the format of our workshop today.
Thanks, Shannon. Hi, everyone. I'm Sophie, and I'm here to talk about Project Firstline. So Project Firstline is a CDC-funded initiative that provides infection prevention and control education and training to help frontline healthcare workers. In California, Project Firstline focuses specifically on certified nursing assistants in skilled nursing facilities, and in coordination with public health infection prevention partners, Project Firstline offers competency-based health education and training and support for facility educators like yourselves. So welcome. Together, we can reduce HAI in California skilled nursing facilities and keep our residents safe and healthy. So with Project Firstline's goal in mind, we developed an infection prevention and control training toolkit and implementation guide for skilled nursing facilities and local public health departments to guide educators through the process of planning and implementing IPC training for CNA. All right, so the toolkit and implementation guide has tips for how to use our Project Firstline IPC training materials and for CNA in your facility. The toolkit is available as a PDF on our Project Firstline webpage. You can access all training curriculum materials via the webpage and download any files you may need for your trainings. So the Project Firstline training materials span 8 modules of IPC content that are ready for you to use out of the box as needed. Each module includes curriculum slides with presenter notes, a pre and post training questions file with answer key, embedded knowledge checks to encourage an interactive training environment, an FAQ document with references, and promotional materials. These items are part of the toolkit's appendix and are available in both English and Spanish, which will hopefully address some of those language barriers as noted in the chat. We understand that's a barrier for sure. Today we will highlight select slides from each of the 8 modules. It is important to note that the actual module slide sets are much more robust and provide 20 to 30 minutes worth of interactive training content with knowledge checks, video demonstrations, and each module contains all 5 appendix items to enhance your trainings. In this workshop, we will use select slides and appendix items as examples to demonstrate educational principles rather than to train on the module topics themselves. We encourage you to review the entire modules after today's workshop to become more familiar with the content. And today, as we go through each module, I will demonstrate how you as an instructor can access the toolkit curricula and appendix items. Shannon and Aurora will demonstrate how you can implement the material through different training types while providing teacher tips along the way. We know your days are always busy, so we want to make your teaching experience as streamlined as possible. Let's dive in.
Thanks so much, Sophie. So in the first module, we will review the 6 elements of standard precautions and provide CNAs with an understanding of why these practices are needed to maintain a safe environment of care and reduce healthcare-associated infections, or HAI. I will demonstrate how you, the trainer, can provide this education as a formal presentation by highlighting a few slides from Module 1. First things first, we need to access the slide set through the toolkit.
The PDF toolkit webpage, and the slides and recordings from today's workshop will be posted on our Train the Trainer webpage at the conclusion of this week's workshop. For this presentation, I'll be walking us through accessing the toolkit through screenshots of both the PDF and the website toolkit. So the PDF toolkit is a file that you can download and save on your computer, whereas the webpage is the webpage. Again, these will be live and available for use at the end of the week this week. So to access the slide set for Module 1, we'll head to the Project Firstline CNA Training Toolkit webpage, which is shown here on the slide. We'll scroll down to the training modules table of the toolkit page. There is a section within the table for each module. If it's not already open, click the caret to expand the section. For Module 1, navigate to the slide set and click to open the PDF file in another browser window. Once the file has opened in another tab, you can choose to download the file or print it from the browser. Note that you will also have access to the presenter notes, which will provide a suggested training script to go along with the slides. And now our trainer Shannon has the slide set for Module 1 all set to go, and she can give a formal presentation to her CNAs.
There are 6 elements that make up standard precautions. Each of these elements are important infection control practices that should be followed all the time in all healthcare settings to maintain a safe environment and break the chain of infection. Hand hygiene, environmental cleaning and disinfection, injection and sharp safety, use of proper personal protective equipment, or PPE, based on activities being performed, minimizing respiratory exposures, and reprocessing reusable medical devices between each resident and when soiled are all elements of standard precautions. As a CNA, you come into contact with residents more than anyone in the facility. You bring them food, help them bathe, or use the restroom, as well as check in on them throughout your shift to make sure they're receiving the best resident care. During that time, you're touching many different types of surfaces and residents, potentially passing germs. Studies have shown that as a CNA, you touch about 912 services during one 12-hour shift. During that time, you're not with one resident. You might be taking care of 3, maybe even more at the same time. In 12 hours, think of all the germs you might pick up on your hands in those moments. Without proper hand hygiene between caring for each of those residents, your hands can make your residents sick. Always remember that 20 seconds can save a life. Every moment matters. There are 5 moments for hand hygiene: before entering a resident room, before any aseptic procedure, after contact with bodily fluids, after leaving a resident room, and after touching a resident's surroundings. Even though CNAs are not touching the IVs, Foley catheter, or vent, they are doing oral care, perinatal care, or baths where hand hygiene is crucial. Hand hygiene is the most effective step one can take to stop the spread of infection. When it comes to PPE and hand hygiene, do perform hand hygiene before donning and after doffing your PPE. Hand hygiene should be performed after the removal of gloves. Don't wash your gloves or reuse your gloves, and do not double glove or double gown. Let's walk through an example. A CNA is helping a resident move from the bathroom back to the bed and hears the resident next door yelling for assistance. As the CNA leaves the first resident's room to go help, they remove their gloves, perform hand hygiene with ABHR, enter the next room, and place a new set of gloves on before helping the fallen resident. Remember, we must change gloves after every resident interaction and perform hand hygiene in between every glove change. Use a new set of gloves for every task and never reuse gloves. Hand hygiene and reusable device cleaning go together in preventing the spread of infections. When cleaning and using a reusable device, always perform hand hygiene. Hand hygiene should be performed before and after cleaning or using a device. By practicing hand hygiene in every element of standard precautions, you can prevent the spread of infection. I'll break character slightly here to tell you that within each slide set, there are embedded knowledge checks to review with your CNA. These tie back to the module's key concepts and promote an engaging training experience. When you present this to your staff, you can say, as a CNA, when with your residents, every moment of contact matters and is an opportunity to perform hand hygiene. There are key moments with the resident that will always require at least one method of hand hygiene. Can you identify them all? Make sure to pause for at least 10 seconds to allow for staff to have time to think through the question and select an answer before moving on to the next slide. You can then present the answer to staff and review the reasoning of both correct and wrong answers. For this knowledge check, it's essential to make sure that staff not only understand the when of the 5 moments of hand hygiene, but also the why. If staff answer the question incorrectly, take time to refer back to the training module to review concepts or engage in discussion of the rationale.
Thanks, Shannon. That is a great example of how you might train your CNA using the material as is. Now I am going to, now that we have reviewed how to give a formal presentation, I want to highlight some teacher tips that you can use to support your staff's learning. You can provide training in different settings, such as in a classroom or onboarding presentation. You can reference presentation visuals like the images used throughout the modules to support visual learners. You can use the Project Firstline CNA recorded trainings that review proper IPC practices. These are available on the Project Firstline webpage. Use training activities like the knowledge checks that are within the module slide set, or you can create your own. For example, you can ask for volunteers to demonstrate proper hand washing techniques, or you can give staff alcohol-based hand rub and demonstrate the hand hygiene process as they follow along. You can also use case scenarios. Just like the training activities, case scenario opportunities can be completed in groups or one-on-one with individual staff. Here is an example of a case scenario you can post to your CNA after giving a formal presentation. You just change a resident's dirty linen and they request an extra pillow. What should you do before getting the pillow from the linen closet? Make sure to give your staff time to think through each scenario. Answers can be provided in an open discussion or made into a poll question, depending upon where and how you are presenting the material. You can also create your own examples to talk through common scenarios that happen at your facility.
You might not always have time for a formal full-length presentation or training. You can use the Project Firstline curriculum in other ways. Let's now look at how we can use the training material to train staff during a huddle or other similar brief training. Maybe you notice that your staff would benefit from a quick huddle review on how to properly don and doff PPE. To do this, we'll highlight slides from Module 2, which reviews correct PPE use and proper methods to don and doff PPE. Again, the full set of curriculum slides is longer, but during a huddle, you can use just a few slides if you only have a few minutes to train. We'll start by selecting specific slides from the slide set.
We know we want to pull several slides from the Module 2 PPE slide set. Say we've already previewed the PPE curricula slides on our own, and we know we want to use slides 10 and 11 to review the proper PPE donning and doffing processes with staff, as well as slides 16 and 17, which include a knowledge check to gauge your staff's IPC understanding on this topic. We'll pull these specific slides from the Module 2 curricula slide set to have them ready to use in a huddle training. On the webpage, we'll navigate to the Module 2 section of the training modules table, again clicking that caret to expand the section if it isn't already open. Find the slides in English and click the link to open the slides in another browser menu. To select the specific slides to print for our huddle training, we'll go to File and Print and select the slides that we need. You can either print these directly or save the selected slides as a PDF. Here I'm saving as a PDF and selecting slides 10 and 11 to show my staff, as well as the knowledge check questions on slides 16 and 17, as you can see here on the screen. Once saved, I'll print the PDF. You can print one large copy for yourself to show your staff, or you can decide to print multiple copies and distribute them depending on how large your huddle may be.
Thanks, Sophie. So you downloaded the module slides and now you're ready to train your CNA. You can share printed graphics as printouts in an educational binder, or you can send the images via text messages if this is how you communicate with your staff. Depending on your staff needs, you might provide copies to staff to review ahead of time before meeting as a group. Take a moment to think about how you communicate information with your staff and what might work best for your specific facility. In your huddle, you might talk about donning and doffing in the context of IPC. For example, you can demonstrate the 6 steps to your staff while referencing this slide. You can have the ABHR and PPE available to use during the demonstration and say to your staff, let's walk through the donning process. First, before donning your PPE, complete step 1 and perform hand hygiene with alcohol-based hand rub or ABHR. It's also appropriate to wash your hands with soap and water. Then complete step 2, decide on and gather the PPE you'll need for the task. After gathering your PPE, complete step 3 by putting on your gown. Tie all of the ties on your gown or snap all the buttons. The next step, step 4, is to put on a NEOSH-approved N95 respirator face mask, depending on your type of anticipated exposure. Both your mouth and nose should be protected. Do not wear a respirator or face mask under your chin or store a respirator or face mask in your scrub pockets between residents. After putting on a respirator or face mask, complete step 5 by putting on a face shield or goggles. Face shields should provide full face coverage. Goggles are also acceptable. Finally, complete step 6 by putting on a pair of gloves. Gloves should cover the cuff or wrist of the gown. Healthcare personnel may now enter the resident's room with donned PPE. If timing permits, you can have your staff demonstrate the process of proper PPE donning and doffing sequences with return demonstrations as you go through each step. You can also have your staff demonstrate proper sequencing with partners to look for self-contamination. Give staff proper time to demonstrate each step and reinforce IPC knowledge by asking why they're doing each step as they move through the sequence. To promote continued adherence, you could print this slide and laminate it to create a poster or a badge buddy for staff to reference. Remember, we also selected a knowledge check from the PPE slides to gauge staff IPC understanding. Each module has embedded knowledge checks throughout the presentation. After reviewing the PPE donning and doffing sequence with staff, you can ask this knowledge check question either aloud or by showing the question as a printout. What is the key step to complete before donning and doffing gloves? Is it A, hand hygiene, B, asking the resident how they are, C, identifying other types of PPE to use, or D, putting an extra pair in your pockets just in case you need them later? You all know the answer is hand hygiene. Though the slide is presented as a multiple choice question, you might decide to use it as an open response question or create a discussion based on the question. However you decide to present the knowledge checks, take time to provide the correct answers, acknowledge correct responses from staff, and help staff navigate any incorrect responses by providing rationale or reviewing concepts. We really want to foster an environment of continued learning and adoption of key IPC practices. One of your roles as a trainer in your facility is to provide space for your staff to ask questions and learn so they can provide safer healthcare to your residents. We'll now talk about how you can train your staff during a just-in-time training. Just-in-time trainings are trainings that deliver information precisely when the learner needs it. Let's say you're doing your usual rounds on the floor and you observe an improper IPC practice. With a just-in-time training, you can engage with staff immediately to support staff IPC understanding. We'll use Module 3's material to better understand how you as a trainer can do this. Module 3 discusses the role of environmental cleaning and disinfection in preventing the spread of germs. It also reviews how to read the product labels and required contact time or wet time. Let's walk through a case scenario. You observe your staff opening the bathroom door to empty a resident's bedpan. After they empty the bedpan, they close the bathroom door and turn down the lights of the room with the same gloved hand. This occurs after EVS staff have already cleaned the room for the day. In this scenario, you can find key messages from the curriculum to share with your staff in a just-in-time training situation. You might pull the individual staff aside to review key IPC concepts, or you might also bring in nearby staff for an impromptu group review. You might not have time to print slides between observing the incorrect IPC practice and providing just-in-time trainings, but you can prepare for these types of situations by familiarizing yourself with the CNA curriculum and maybe even having easy access to a binder with printed materials that you can show your staff. Like in a huddle training, you might share select slides with your staff and have them available in different formats for a quick reference tool. There are many ways to continually engage your staff in learning how to understand why we perform IPC practices. Here is how to access select slides from the PDF version of the CNA training toolkit.
So far, we have been navigating directly to the toolkit webpage to download slides. Here we show the PDF version of the toolkit, which you can save to your computer. Within the PDF toolkit, you can use the table of contents to link to the module or simply scroll through to find the module you're looking for. In this case, I'm looking for Module 3 on environmental cleaning and disinfection, and can from there navigate to the curriculum slides section and click the link to go to the slides in English or Spanish. This will open the file on the toolkit website. This is the exact same file that the web page opens when you click the link. So you're getting to the same file, but one is coming from a saved document on your computer and one is the web page. Similarly to the last demonstration, you can file, print, and select specific slides. For this case scenario, I'm selecting slides 9 and 27 to review how contaminated environmental surfaces can lead to infection and to review high-touch surfaces.
So in our case scenario, recall that your staff used the same gloved hands to empty a used bedpan, then touch the doorknob and the light switch. You may review these key messages on how contaminated environmental surfaces lead to infections in a residence. For instance, the healthcare environment can be a source of germ spreading. Some germs live on surfaces for hours, days, or even months. When a resident, healthcare personnel, or visitor touches a surface, they might leave germs. Anyone who touches the same surface can pick up those germs. During your just-in-time training, remind staff that both the doorknob and the light switches are considered high-touch surfaces where proper IPC practices must be implemented. This includes in performing proper hand hygiene, donning and doffing gloves at the proper time. You can reinforce the staff that if a clean area was touched with dirty gloves, they can use a wipe to clean and disinfect the surfaces. And don't forget to provide additional rationale as needed. Here's another example of a slide that can be used as a reinforcement tool during a just-in-time training. This slide lists examples of high-touch surfaces. In the corresponding presenter notes, we remind staff that CNAs touch many surfaces and should ensure that high-touch surfaces in resident rooms are cleaned regularly. As we move through our day, CNAs should help reduce cross-contamination and help reduce the risk of spreading germs to the resident by ensuring proper hand hygiene, PPE use, and cleaning and disinfection practices. You can ask staff to point out other high-touch surfaces in the resident's room to demonstrate understanding. The slide makes a great handout or poster that you can place at the nursing station or break room as a visual reference too. Module 4 reviews methods to reduce the spread of infection during skin, perineal, and urinary catheter care. Additionally, this module discusses the role of a healthy skin barrier for preventing pathogen transmission and proper protocols to implement during skin, perineal, and urinary catheter care. We've now seen how examples of how to use CNA curriculum as a formal presentation in huddles and as in just-in-time training. We'll use Module 4 content to show how you can use embedded knowledge checks to further engage your staff.
So embedded knowledge checks are included within the slide set of each module. You may have noticed some sprinkled in this presentation so far directly from the slide sets. They're also available as a separate appendix item with all of the knowledge checks extracted from the slides and displayed in a table format. You can use the knowledge check files outside of a formal training to engage your staff in IPC discussion or even as pop quizzes in your facility. To access the embedded knowledge checks for Module 4, I'll open that section of the training modules table on the toolkit webpage. I'll find the embedded knowledge check appendix item in English and click to open the file. Again, the file will open another browser window. From here, you can print or download the file.
Using the embedded knowledge checks appendix file, let's look at the question on slide number 14 within Module 4. The file lists the slide number where you can find the knowledge check in the module, the questions and response choices. These are also listed on the slide, and the correct answer or sample answers if it's an open response question. Each module has 2 or more knowledge checks throughout the curriculum. Here we ask, what is your role as a CNA when a resident develops diabetic or peripheral vascular disease-related skin injuries? This is an open response question, so as trainers, we should pause here for 5 to 10 seconds to allow for thought and response. This might seem like a long time to wait on your end, but we want to make sure our staff have enough time to process what they just learned and heard to provide a thoughtful response. After some time and maybe some volunteered responses, you can then review the correct answer and review incorrect answers as needed. When presenting in person, you can use available resources such as a whiteboard or projector to display and present knowledge checks to staff. Alternatively, knowledge checks can be provided as handouts or given verbally. You can have staff answer questions in person individually or break up into groups to discuss with peers. You can also have staff complete activities that relate back to knowledge checks to reinforce concepts. For example, if providing a knowledge check on proper PPE, you can have staff demonstrate proper donning and doffing sequences to reinforce understanding. You might also use these as part of trainings that you already have at your facility. Get creative and use knowledge checks in a way that works best for your specific facility's needs. If you have a facility with multiple sites, you might consider providing trainings via Zoom, MS Teams, WebEx, or similar to present materials in multiple locations. The CNA curricula translates really well to a virtual setting. Knowledge checks that are true or false or multiple choice questions may be presented as poll questions that pop up on the screen, or you might have staff engage in virtual discussions via the chat feature or come off mute to share responses. Breakout rooms can also be used to encourage peer conversations, as well as screen annotation features where staff can type answers on the presentation directly.
Module 5 reviews key IPC practices when providing oral care and feeding residents. It also discusses the role of good oral hygiene and proper feeding techniques to prevent the spread of common oral health problems and infections. Each module includes a pre and post training questions file and an answer key that you can use to enhance your staff learning. Pre and post training questions are meant to evaluate the knowledge of your staff before and after each training session. A pre-test can help us understand the current level of knowledge as our baseline. A post-test can tell us if there is a change in knowledge or if additional training may be needed. Let's access a sample pre-post training question file from the toolkit using Module 5 curriculum material as an example.
I'll navigate to the training modules table, go to module 5 and select the pre and post training questions with answer key appendix item. Click to open. The first page of the file includes facilitator notes with ideas and tips on how to use these pre and post training questions, as well as the answer key for each module. Correct answers are highlighted in yellow. The following pages of the file can be printed for your staff to fill out. Note that the pre and post training questions are the same.
Thanks, Sophie. Now let's review how to use these questions during your trainings. Note that using the pre and post training questions as is would add an additional 5 to 10 minutes before and after each module. We suggest printing a copy of the pre and post training questions for each CNA to decrease potential test anxiety. Let them know that they are not going to be graded on their responses. Results of the pre and post tests can help you determine which infection prevention and control concepts were well understood during the training session and which need additional time for training. The tests have a space for names, but answers may be collected anonymously if preferred. Make sure to provide correct answers after the tests are administered. You may decide to review the questions and answers as a group after the training. Another suggestion is to use these questions for post-training discussion to address any questions or concerns or to provide a review of the training materials. This can be done immediately after the training session or on a separate occasion, like in a huddle. Let's say that you administer the pre-training questions, provided the training, and then administer the post-training questions. Let's talk about what can you do when staff may answer questions incorrectly. For example, let's say that many of your staff get questions 3 and 4 wrong on the post test. Their choices highlighted here in red. You can go over these questions as a group and provide rationale. You can also go back to key slides from the slide presentation to review IPC concepts. Number 3 question asks, when should hand hygiene be performed? The correct answer is all of the above, but your staff selected just one option between caring for 2 residents in a room. This is a slide from Module 5 on infection prevention practices while feeding. Is an example of a slide you can use to further explain the answers to the post-training question. Emphasize that in addition to performing hand hygiene between caring for 2 residents in a room, hand hygiene is also needed before any task with a resident, such as touching a meal tray, because their hands could have become contaminated at any point on the way to touching the meal tray. Hand hygiene is also necessary after discarding gloves to remove any germs that may have been transferred to the hands after the process of removing gloves. Reinforce that hand hygiene is considered a key infection prevention and control measure for reducing the spread of germs to your residents. You may select other slides to show as well to enhance IPC understanding. In question 4, we ask staff to what steps should be followed during oral feeding to prevent aspiration events and to identify the step that does not apply. The step that does not apply is C, which is giving solid foods only. To review how to prevent aspiration events, you could review the Preventing Aspiration Events slide with your staff to reinforce understanding. Encourage your staff to ask additional questions so that they have a better understanding of the IPC practices they perform every day. Again, the answer key has correct answers highlighted in yellow. Answer keys for each module are included in the CNA training toolkit. Module 6 reviews key IPC practices during positioning and transferring of residents, ways to prevent infection from pressure injuries, and strategies to avoid skin deterioration and infection by avoiding friction and shearing. Let's look at 3 slides from Module 6 regarding positioning, pressure injuries, and transferring of residents, and then discuss how to use the additional FAQ files to enhance CNA learning. This slide from Module 6 is a great visual aid to help staff learn and understand different positioning terms. As you can see here, supine, lateral, and prone are common resident positions. These images highlight areas of the body that are being pressed down on and are susceptible to pressure injuries. In this and in additional more detailed slides, we cover each stage of pressure injuries and their infection risk and explain the role of repositioning residents who are bedbound or in wheelchairs for an extended length of time. When training your CNAs, it is essential that they understand their role, that they know how to recognize pressure injury concerns, and that they are comfortable communicating these concerns to the charge nurse. This module emphasizes that CNA should always report any changes in a resident's skin to the charge nurse to make sure to keep pressure off the area, to keep the area clean and dry, and to continue to check the area and report any changes. This slide describes the process for transferring residents from a bed to a wheelchair. You can use the notes on this slide as prompts to engage staff in discussion. For example, you can ask, before transferring a resident from a bed to a wheelchair, what IPC practice you must do first? Or ask, what type of PPE might you need? Or what are some considerations when transferring a resident from a bed to a wheelchair? After discussing contents with your staff, you may want to continue the discussion with additional prompts. Let's now navigate to the FAQ files to access additional discussion topics using Module 6 curriculum as an example.
All right, so each module includes an FAQ file, which includes questions we've received from CNA all over California on each of the module topics when presented during a live training. We've compiled them as appendix items for the toolkit to provide an additional resource for engaging CNA and IPC discussion. Hopefully this screenshot here is looking a little familiar because we're going to navigate to the training modules table on the toolkit webpage, navigate to the module 6 section of the table, and then we're going to look for the FAQ appendix file to open in English. The FAQ file will open in another tab. It includes facilitator notes, the questions and answers, and additional references with links.
Each Project Firstline CNA module is designed to provide 20 to 30 minutes of training content with optional post-training discussion using the FAQ files. You can use any or all FAQ to initiate further discussion among CNA after trainings, during huddles, or team meetings. After providing training on positioning and transferring of residents, you might, for example, receive questions about rubbing techniques to promote circulation, skin tears, or moving a resident on transmission-based precautions. The purpose of the FAQ is to provide information on frequently asked questions or concerns. If your staff asks you a question, there might be an answer here already. Familiarize yourself with the FAQ files so you can better support your staff. You may also create your own FAQ based on your own risk assessment or by using the questions your staff ask you after your trainings. If you get other questions that you don't know the answers to, the references are listed in the FAQ and are a good place to start to look for answers to new questions you receive. Please feel welcome to reach out to the HAI program for assistance with answering any challenging questions. Module 7 reviews key IPC practices during bathing and dressing to help prevent the spread of infections among residents, including identifying proper PPE to use while bathing and dressing residents. You might have CNA staff who have a preference to learn in Spanish. If you are able, you can also provide training in Spanish to promote better understanding of IPC concepts. We will use Module 7 curriculum to demonstrate how trainers can access and use materials in Spanish.
The PDF version of the toolkit has two appendices, Appendix A and Appendix B. Appendix A includes all of the training resources in English, and Appendix B, seen here on the left, includes all of the training resources in Spanish. So that's on the PDF document that you can save to your computer. The files linked in the PDF toolkit appendices are also linked on the toolkit webpage here on the right. On the webpage, the English and Spanish appendix items are listed by module, as we've seen in previous demonstrations. As we add additional languages to our toolkit, we will include them both in the PDF and web versions. Here, I'll navigate to the toolkit webpage, and for this demonstration, I'm going to Module 7. I click on the Spanish Curricula Slides appendix item to open that file in another tab. Similar to the English version, you'll have access to the presenter notes with the Spanish slides, and this will be in Spanish.
Let's look at an example slide from Module 7. The English version is on the left, Spanish on the right. As you can see, it is the same content. The Spanish content was translated by fluent Spanish speakers with medical and infection disease background. Using the slides in a language your staff prefers for learning may maximize comprehension and increase the accessibility of your trainings for Spanish-speaking CNA. In addition to slides, the pre and post-training questions and answer key are available in Spanish, as well as the embedded knowledge check and the FAQ files. The CNA Training Toolkit also includes promotional materials and messaging for each module, currently in English only. Promoting your trainings are optional, but may help your staff stay motivated and reinforce training content. We are calling them promotional materials, but you can use these files after training to post messages in break room or to send as a text reminder to your staff. Let's say that you are going to host a training using Module A content on bathing and dressing and want to promote it to your staff. Module 8 reviews key IPC practices during nail care and shaving to help prevent the spread of germs and discusses injuries that may occur during personal care. Let's look at where to find promotional materials using Module A curriculum as an example.
All right, you guessed it. So I'll navigate to the toolkit webpage to access the promotional materials for each module. In this example, I'm heading to Module 8, section in the training modules table, scrolling to the promotional materials and clicking the appendix item to open the file. The promotional materials file for Module 8 is now open. Aurora will walk you through this document.
The promotional materials file include facilitator notes, sample messaging, and links to sample images, the flyer templates to promote your trainings. The materials are meant to supplement the training curriculum and are completely optional to use. You can share sample messaging via email or text message with or without the corresponding image. Images can be used as provided for digital communications or printed out and posted on workplace bulletins. Flyer templates include sample messaging and its corresponding image and allow you to add details about your training, like the date and location. You can edit the flyer templates in a PDF editor or print them out and add the information by hand. Again, we welcome you to share training materials with your facility CNA via text, email, in person, hard copy, or post it in the break room or message boards, whatever you think will engage and benefit your CNA the most.
We did it. We looked at all the modules and toolkit resources and talked about ways to incorporate IPC training in your facility. Now let's talk about addressing some barriers to provide IPC training to your CNA. As you recall, we asked about these barriers to training at the beginning of the workshop. Let's review each potential barrier in more detail. If you're unsure where to start, this workshop is a great place. Hopefully you've picked up some ideas of how to train your staff on IPC practices. Enlist other leaders to assist you with this effort. Work with your leadership or IPC champion from nursing, physical therapy, the activities team, and environmental services. There are 3 of us today sharing this information with you. Was it a dynamic experience? Maybe you can do something similar in your facility. Start small, train one module at a time. Maybe you'll start on one station and then roll out a training facility-wide. Maybe break it down into smaller parts. And lastly, know your audience. Who are you training? Consider their current level of understanding and consider their learning or language preferences. If there's a lack of leadership support for training, think of easy ways to involve leadership. You can ask leadership what their barriers might be to training, or give them an opportunity to be part of the training. Maybe ask them to be a trainer or designate them as an IPC champion. If you're unsure what training materials to use, consider the curricula shared today. We encourage you to review the current resources in the CNA Training Toolkit. The website is linked here. And we should also mention that there are recorded trainings on our website if you prefer to show recordings and then engage your staff in further discussion afterwards. If you've encountered time constraints or staff availability is an issue, you can decide to use select slides to train specific staff and not necessarily the whole slide set. Like we demonstrated today, you can train during daily huddles or in just-in-time format. Training doesn't need to be a formal presentation with projector and slides. It can be on-the-spot quick reminders, or you can use already standing meetings to incorporate some IPC messages. Consider including the CNA curricula as part of a new hire or annual orientation, and train anywhere, nursing stations or in a classroom if available. There are many ways to train CNA on IPC practices. If you're not feeling 100% confident with your level of CNA IPC knowledge, we encourage you to review the toolkit and implementation guide, review the CNA modules and corresponding references. CDC has a training for SNF IP, as does the CDPH HAI program. And work with your corporate IP if you have one. They're a great resource and can provide you with additional guidance. And we encourage you to attend the IPC for CNA Train the Trainer office hours next week, Friday, July 28th from 11 to 12 p.m. This is an opportunity for you to ask questions and hear from our team of IPs and experts in IPC. Register for office hours using the link in the chat.
Now that you know what training material to use and how to overcome some common training barriers, let's talk about how to sustain IPC knowledge and practice among your CNA. The HAI program adherence monitoring page is linked in the toolkit with tools and additional resources to help monitor IPC practice among CNA. You can use this or similar tools if you already have some in use at your facility. Regular monitoring with feedback of results to staff can maintain or improve adherence to IPC practices. You can use these tools to quickly identify gaps in processes or training. You might find that a common resource or educational need may be required among your CNAs. Let's look at one of the tools more closely. This is the adherence monitoring tool for hand hygiene. There is a space on the front to observe 10 hand hygiene opportunities and an additional 10 on the back. You can use as many pages as needed to complete your observations. After you observe your staff's hand hygiene practices, you'll calculate a percentage adherence, which can be shared as part of your feedback to staff and leadership. The CNA Training Toolkit includes a section on evaluating your training program. There are several ways to do this, including administering the pre and post test, using adherence monitoring and feedback tools to identify gaps in IPC practice, and looking at process and outcome measures. You can read more about each in the PDF toolkit. As an educator in your facility, you are the CNA IPC champion and expert. We encourage you to promote ongoing trainings and incorporate CNA IPC practices in your facility culture, meaning talk about IPC practices regularly, make it a habit versus a task. Everyone should be encouraged and comfortable enough to bring up any concerns or questions. Review and recognize when your staff need training or retraining in IPC concepts. Use your adherence monitoring observations to inform your training content. Encourage your CNA to involve residents and families when providing care. For example, you can share with residents and families why hand hygiene is key when they are involved with providing oral care or perineal care. You can review with them why we reposition residents to prevent pneumonia or pressure injuries, and let them know that they can bring up any concerns with the nurse. And lastly, continually celebrate any size success. Share feedback with your staff and provide positive support in an open forum for them to chime in. Use these opportunities as a motivator to produce more change. Finally, let's wrap it up with a poll question, which will pop up on your screen. Tell us, after today's workshop, do you feel comfortable navigating the toolkit to implement IPC training for your CNAs? Select all that apply. A, yes, I am ready to train my CNAs. B, yes, but I need more time to review the toolkit. C, yes, but I need more time to review CNA IPC concepts. D, no, this is not for me. E, or other, share any details in the chat. Let's give a couple of seconds so everybody gets an opportunity to participate. Okay, we can go ahead and end that poll and share the results. A, yes, 46% says that you guys are ready to train your CNAs. 49% say yes, but that you still need a little more time to review the toolkit. And 60% said that you are ready but need time to review the CNA and IPC concepts. Thank you so much for participating. We appreciate it.